Hi guys, my name is Soraya and I talk about health, skin, hair, and anything that deals with your overall well-being, especially in terms of skin, healthcare, and your hair. Generally to anybody who is suffering from the conditions that I mentioned. So today I am gonna be doing my skincare. So while I'm doing my skincare, I'll be talking about scalp soreness. Scalp soreness is something that a lot of, I would say, African American or Black women deal with, especially in relation to alopecia. However, it's a condition that occurs across the board. I mean, I've had it being discussed by Caucasian women, also men, also anything that is related with like scalp tenderness, balding, hair thinning. It's in that category. So I'm going to be talking about scalp soreness, and for me, like my experience with scalp soreness is as a child. When I was a child, I used to use a lot of coconut oil, and it's what you have. You use what you have. So I would use the coconut oil, and when you're doing your cornrows, you're plaiting your hair, and they would do it really tight, and I experienced like scalp soreness around my crown, which I didn't know before, but like I didn't have before, but after that I experienced it, and I remember it as a child. So it was very painful at my crown. I developed some like dermatitis, those pimples that you get when somebody tugs on your hair. And ever since that time, I've had like scalp soreness around my crown. So I don't know if that was the trigger or it was gonna develop anyway, but that was like the beginning of me having scalp soreness. And I mean, apart from it being just because of the hair tightening, let's talk about the hair tightening. Sorry, I'm just using this Glow vitamin C clay mask to, I don't know if you can see it. Yeah, vitamin C clay mask, and it says G. It's actually not glow. It says glow, but it's actually gleaming. It's part of the gleaming whatever, but it's written glow at the top. I'll be putting this on my face. So yeah, so in terms of hair tightening, other things that can cause that kind of soreness is braiding. So it can be associated with braids, wigs, cornrows, anything that causes you to tug on your scalp. Tight hairstyles, especially those around the crown, or maybe at the bottom, like when you put a bun up or down here. And for that kind of situation, to relieve that kind of situation, just try and avoid those kind of hairstyles, or let your scalp rest for a while. So if you have to reduce the braiding, you can stop the braiding for a while, stop doing the tight cornrows, or look for somebody who doesn't pull your hair that much. Have you gone to especially, let me just talk about African salons. They tighten your hair like, oh my god, and then you start losing your hair. That kind of thing, just try and avoid that, because yeah, I'll just let them know you're doing it too tight. If you can just reduce that, so that you don't end up losing your hair in instead of making your hair look good, you're gonna lose your hair in the long term. Yeah, and then so just try and avoid those hairstyles and see if it helps. And then also heat can also cause that kind of scalp tenderness. If you're doing a lot of blow drying, or what is it called, straightening with that doing like bone straight hair with what is it called, Yeah, I forgot. What I meant to say was flat ironing. If you're doing a lot of flat ironing, yeah, try and avoid doing that. Or as I said, try and at least make your scalp rest for a little while you're giving your scalp at some time to recover. And then also sometimes it may be due to like environment, like if you're in a very humid, or not humid, very dry area, or also if you are using things which can dry the scalp, like hard water. If you're using like a lot of hard water or things like that, and your scalp is being irritated, because mainly the scalp soreness is due to like either precipitated by trigger points or leads to inflammation, which causes the scalp to now react. Then you get, you know, either swelling, pain, warmth around that area. Eventually you get, if it's for a long time, you start to get either thinning of hair or loss of hair, and if it's permanent, you start, now it starts going to alopecia. So depending on how severe or sensitive your scalp is, you just have to you know, see what you can do to either rest your scalp or stop any hair loss that may occur. For some people, it might be what they're eating, especially if you're lacking some kind of things in your diet. So if you're lacking like iron, vitamin, especially like the vitamin B, especially like B12, but it can be any vitamin B type, and minerals like zinc, selenium, copper, magnesium. If you're lacking those things, sometimes your scalp may be also sensitive, and what happens is that you either because you need the irons for certain things in your body, so for like hair growth, for to reduce the inflammation and things like that. So if you're not getting enough of those vitamins, and it can cause your hair to start falling out or to thin, and that can cause you to have that kind of scalp tenderness, which usually precedes the hair thinning. So for example, I am an anemic, and I know that some like the when I take more iron, my hair improves a lot. So in terms of scalp tenderness, you know, if you think that is a relation, then you need to take more of those vitamins in your diet. Take a healthy diet generally, but also like supplement with your iron, with your vitamin B, with your selenium and zinc. Especially selenium and zinc is good for the hair. And then also in terms of, because as I said, you can like, it depends on individuals. For some people, when they put oils on their scalp, it helps them, and for some people, when they put oil on their scalp, it's detrimental. As I said, when I used coconut oil, it was, for me, it's detrimental, but for some others it helps them. So it also depends, it's individualized, so you have to see what you think, what is happening on yourselves, to see if it's going on well. So for me, like if I put coconut oil, I get bumps, I get the dermatitis. For some people, it's other things. So the other thing I was trying to lead to was that you can get folliculitis, dermatitis, types of infections which can cause you to have the scalp tenderness. So it might be aggravated by the oils, it might be aggravated by the things that you're using on your scalp, like chemicals. It might be aggravated by heat, chemicals, and dyes. So those things are things you might want to avoid, especially like hair dyeing. Definitely strips the hair out of its oils, and it may cause your scalp to become tender. In terms of infection, You can have different kinds of infection. You can have bacterial infection affecting your scalp, fungal infections, so like ringworms. For the other things which affect the scalp itself, like there are people who have things called like lichen planus, which affects the scalp and the skin in general, and eczema on your scalp. So depending on what kind of infection that you're having, what kind of skin condition you're having, it can cause scalp tenderness. And if it's a fungal infection, you can use things like Nizoral shampoo, the ketoconazole shampoo. Ketoconazole shampoo helps to reduce the fungal infection. It also helps to reduce the inflammation on your scalp. So that really is really good to help both ways. But if it's anything other than that, and you think it's maybe like a bacterial infection, it's good to go to a dermatologist so that they can diagnose what is going on with your scalp or your hair and send it to a lab, or just look and see what it can be and give you the right treatment. So because for some it's topical, for some you might have to get oral antibiotics or oral fungal medication to clear it out depending on how severe it is, and other treatments. Some people use a combination of steroid, fungal, and bacterial treatments. So it have to be custom made. Yeah. So that's for the fungal infections, bacterial infections. So that is how you would treat that. And in terms of heat styling, try and avoid heat as much as possible. If you can. I know for like 4C hair, sometimes it's really unmanageable to use not to use heat. So you can try using less heat, like lower the heat, or use cool air to just dry out, especially when you're doing a wash day. But if you can avoid it or you have manageable hair, then just do your wash and let it air dry if possible. And then also when styling your hair, you can try avoid the crown area, like tight buns at the back or at the crown. Or if you're doing like braids, if you have like sensitivity around the scalp, try not to that like central part, so that the hair pulls away from the crown, so it will create tension on the crown area. So try and avoid that. Try and make styles that concentrate the area in the middle, so that you don't have tension in that area, so that it pulls towards it rather than away from it. And then I mean, if you can avoid the braiding at all, and if the braiding is causing you problems, then you can leave your hair out for a few days or so, or just try to make very loose hairstyles that will not cause tension on your head. And most of the time, like, scalp sensitivity may not even have triggering factors. It may just be genetic. Actually, dermatologists say that most of the scalp sensitivity is genetic, and that's why I started with saying that it occurs. What I've heard is that most people, especially African American people, have had scalp soreness, and in relation to alopecia, which is why I believe that it may be genetic. That might be a predisposition related to how your hair grows, how your scalp is, and things of that sort, in related to genes or being hereditary. And if in that case you may be able to deal with it somewhat, but not completely. But as I said, just avoid the certain trigger points that may be causing you to make it worse. So if it's genetic and things like that, you might have to just like deal with the condition as it evolves. It may not go away completely. You might have to see a dermatologist, and the dermatologist might recommend certain things. Apart from the medications, they might also give you something for pain, things that will treat the nerve pain and help it go away. Of course, for some people, they have What dermatologists say is burning scalp syndrome. So you can Google that and see if that is something that you have. And yeah, so sometimes they give some pain medication for that condition. And depending on what is triggering it, they might also add like a bacterial or fungal or steroid medication. Yeah, and other things also which may trigger the scalp soreness, which I may not have mentioned, is stress. Stress, mental stress, like emotional stress, can cause you to have scalp tenderness and hair falling out. Medications like chemotherapy may cause you also to have scalp tenderness. Stress, physical stress, like, you know, if you're like working a lot or like doing something that is physically like stressing your body, or an infection which is physically stressing your body, like if after surgery, or even COVID has been associated with hair loss and scalp tenderness. Yes, and pregnancy also. Pregnancy can also cause you to have that scalp tenderness and hair loss. You know how in pregnancy some people have a lot of hair and it grows very well, and then for some people they lose their hair. So yeah, that can cause that kind of scalp tenderness and hair loss. So if it's those kind of conditions, then you know, for like pregnancy or chemotherapy, you just have to, you know, sometimes like wait it out until after the pregnancy, but also, you know, continue eating a healthy diet, continuing to prevent any triggers, you know, taking care of your scalp well. The other thing which I didn't say about the tight hairstyles is that in terms of hair care and scalp care, when you have that kind of scalp tenderness on your crown, I've seen this on certain videos, they recommend that you like tilt your head down so that the blood flow goes to your crown or whatever area the scalp tenderness is, and then massage your hair, massage your scalp so that the blood flow is enhanced throughout that area. And then once you have, you like massage like for 5 minutes. Of course you don't want to like get dizzy or anything, but just enough so for you to have enough blood flow to that area. So when you're like after wash day and you're you know, putting some cream or oil on your hair, you tilt your head and then just massage and tilt your head down, massage, and then you can put your head up for a while. That tries to help blood flow in that area. And then also exercise really helps to pump that blood to your scalp, and your hair gets all the nutrients that it needs right in the area that it's supposed to get it. So as for me especially, exercise really helps me grow my hair, and it's just that blood flow really helps to, especially in areas where it can't reach, because I feel like in that crown area sometimes it might be hard, like the blood flow is going this way instead of up there, so the blood flow being pumped, make sure that it reaches that area. So yeah, so those are the things that you can do. So I've mentioned very many things. I feel like I've been rambling, but for scalp tenderness, it can happen. It might be genetic, it might be something that triggered the scalp tenderness. Eat healthy, drink lots of water, make sure your hair care is correct, avoid doing very tight styles, especially like braiding, if it's cornrows, weaves. Look for things which are good for you, or for your individualized for you. If you think a certain oil is better for you, you can use that. If you think it's not good for you, then stop using it. Take supplements, vitamin B, iron, zinc, selenium. Exercise is important, and you know, seek a dermatologist. They might give you extra treatments, bacterial, antifungals, and avoid heat as much as you can. And yeah, and then just being aware that you have it, so that you're not doing things that may worsen your condition. And hopefully it goes away for you. And for those who it doesn't go away, it might not go away completely, but just try and learn and live with it. And you know, if the worst comes to the worst, see a dermatologist. Some of them are good, they may not be able to diagnose, some are not. But hopefully you find a good dermatologist who's able to treat your condition. So I hope this helps. I hope you understand a little bit more about the scalp tenderness. And the scalp tenderness also goes back to inflammation. Inflammation is so, like, it's the source of so many things. So try and avoid things that inflame your scalp generally. And in terms of healthy foods, you can try and avoid things which like, try and eat healthy foods which reduce inflammation. Things like oats. Try and avoid sugars. And I think I've talked this, I'll put that in my video about inflammation. Things, for some people it's spices, for some people it's sugars, but sugars a lot causes inflammation a lot. Eat more vegetables, drink more water. Yeah, and I think you might be able to see a difference with that. Okay, so I'm gonna go and wash my face now, and I hope let me know what you guys think about scalp like tenderness. Have you had this condition? Have you what have you done with it? Like, what treatments have you done? Have you had any like different kind of treatments apart from the normal, like, scientific dermatologist? I would be interested to hear if you've had any like herbal like treatments for your scalp. I know some people use like some certain herbs which they can apply on the scalp. I don't know if you guys are interested, like, do have had that kind of thing, and what things helped your scalp or hair improve. Put all of that in the comments. I would like us to discuss more about scalp soreness, because I know it's not uncommon, and it's good to just discuss, and hopefully we'll get a solution to it at some point. So yeah, take care, bye. Oh yeah, subscribe and comment and like. That will really help me reach more people and be able to you know, be able to find solutions for these problems for us. So yeah, like, comment, subscribe, and take care. Bye.